comms person, which I like to think that my job is to talk, but my job is also to take care of the website, the social media, and to come here and kind of promote the service. And I'm joined today by Brooke, who is our wonderful partnership lead in Brighton and Hove. And moving on, so what we'll cover in this, I think it's a very quick, tight session. So in the next half an hour, we'll kind of take you through what UOK really is. I like to call this the golden purpose triangle, which means why UOK exists, how we support mental health in the city, and what the offer really is. What does UOK offer? So coming to the why, UOK is a network of mental health support services. But coming to the why, it's simply because people need mental health support. And you'll see some stats on your screen. 1 in 4 people in UK will experience some kind of mental health problem each year. And now this could be yourself, this could be your brother, this could be your friend who might seem like they're doing okay, but might not be. So there clearly is a need to kind of fill the gap between people who are experiencing mental health issues and the support that's available. And for this is all over UK, but further specifically for Brighton and Hove, we've got some more stats around the average levels of mental health issues and how Brighton has one of the highest suicide rates as well. 14% of mental health admissions in Brighton and Hove also have had no prior contact with services. So this further tells us why there is need for accessibility. And so through this presentation, what we want to take you through is how UOK kind of fixes the gap between the need and what's available there. So if I had to define UOK's kind of mission in one word, it would really be to connect. And if the golden triangle was a square and there was another section of who UOK supports, is of course the people in the community that need the support. And we try to meet them where they are. So we try to go out in the community, but also to meet people at whatever level of support they might need. So you'll find that there's a diverse variety of support that UOK offers. And the other thing is also in terms of who we support, it's like I said, the people that need the mental health support, but we also have the partnership with Brooke will talk more about. And within the partnership, we offer connection. And I think from what I've learned being in the sector for some time is it always helps to know where to go. So that's really kind of the question that UOK is trying to answer along with partners in the community. And that's our mission, to help adults, so it's 18 plus, in Brighton and Hove, to find and receive the support they need to think at the right time and the right kind of support to promote good mental health. And I will hand it over to Brooke now to tell us more about what exactly the offer is.
Lovely, thank you, Nancy. Hi everyone, I'm Brooke, the partnership lead of UOK Brighton Hove, and I'm here to tell you about our new contract that very excitingly launched on the 1st of October, and we are the mental health support services contract in Brighton and Hove. So we're commissioned by NHS Sussex and Brighton Hove City Council, who act as our commissioners. And our new partnership has 2 brand new elements, which is really exciting. So we have community development, prevention and promotion, and we also have embedding co-production within the partnership and within the service. So I'll tell you a bit more about those. It's an expanded service, so we have support for different types of communities now. We have 9 new partners, which is an amazing number. So yeah, we've really expanded the partnership and able to provide community support. So could you please mute communities? Is that muted now? Thank you. Lovely. So UOK Brighton and Hove is a partnership of 21 now, community-based organisations, all working together collaboratively to promote good mental health and wellbeing across the city. And we're delivered by Southdown, who are the lead provider. And they are a Sussex-based not-for-profit provider of care, support and housing. And there's a few people on this call, which is good to see. So Southdown also delivers services within the UOK contract and leads the UOK East Sussex partnership. So you may hear more about that. So our model is based on accessibility. So it's ensuring that mental health and wellbeing support is easy to find, navigate and engage with. We have a central access point that people can be connected to the right support through, and this reduces barriers and prevents escalation into crisis. And we often cross-refer within the partnership, which is really central to ensuring we're reaching as many people as possible. And we're also a deeply inclusive partnership, so we're committed to addressing health inequalities and promoting access for all in Brighton and Hove. We have a very diverse range of services, as you'll see on the next few slides, to suit our very diverse population. And we reach different groups and needs, providing them with support regardless of background, identity, or circumstance. So finally, our approach is community driven. This is what we're all about. So we work alongside our partners to ensure that their voices and the voices of local people shape what we do. And that will be through co-production, so that's designing services with those who use or may use them, including carers, and community development activity. So that is empowering individuals and communities to identify needs, influence system change, and strengthen local wellbeing networks. So this is our new offer. So we provide mental health and wellbeing support for anyone who's 18 plus and living in Brighton and Hove. And our new service has 4 distinct pillars. So they are advice, information and guidance, getting support, community development, prevention and promotion, and things that sit under the lead provider. So things that we deliver as Southdown, the lead provider. So under advice, information and guidance, well, as I say, we have a central access point, and this really is what it says on the tin. It is a central point of information and access for all of our partners, and they also refer to other local community services. We also have money advice, so this is delivered by Money Advice Plus, who deliver, and St Luke's Advice Service, who deliver debt benefit and welfare support. We also have suicide support. So this is through our SOS, Survivors of Suicide Service, Rethink Mental Illness, and they support anyone who's affected by suicide. We also have Quell, which is our digital mental health support platform, and I'll talk a bit more about that later on. It's a really accessible service that's anonymous. And under getting support, this is the biggest area of our work, and there's quite a few services that deliver under the getting support pillar. So this is mainly psychosocial one-to-ones and group work, and that includes our mental health support coordinators who sit in primary care networks, and the group work is delivered through multiple partners, all working in psychosocial groups. We also have a number of drop-ins. So we have a drop-in for women with peer support and trauma-informed. We also have a drop-in for young people and others dotted around the city, which is great. And we have wellbeing activities. So this is bringing people together to really build social connections and look after their wellbeing, using their physical and their mental health, which is brilliant. And employment support. So this is through individual placement support, IPS, and that is for employment support for people who have a diagnosed serious mental illness. And then we have our community development, prevention and promotion pillar. So this is our newest pillar, and under this, we're going to be, through our partners, delivering lots of events all over the city. I actually worked at an event in Hangleton a few Saturdays ago that was great. Mansi was at an event last weekend in Moulsecoombe. And these will mainly be delivered by our partners, the Hangleton Knoll Project, Trust for Developing Communities and Bridging Change. And all of our partners will also be working with us on campaigns. So it's really important that we as UOK promote good mental health throughout the city. And we also want to reduce stigma and make sure that people have the right support at the right time by promoting our services. And we also have training. So this is delivered by Grassroots Suicide Prevention. We also have some training from Switchboard and LGBTQ plus training. And we're going to have other training within the partnership to really embed knowledge and bring everyone together to have a shared understanding of what our communities need. And we're also connecting and listening with communities. So this is through focus groups. We've got community champions who are out there in communities, listening to them and understanding what they need, and then feeding that back into the wider system, which is a really exciting piece of work. And now under lead provider, so we're going to be working really closely with Possibility People and the Lived Experience Action Group to make sure that co-production is embedded into everything we do. That means service design, it means setting principles for the partnership for everyone to follow along with, and it also means co-producing our communications, which is what we're looking forward to doing. We have language support services, so this is, again, for accessibility. This is Sussex Interpreting Services are delivering this. So that will be translation interpreting for anything that people need for language support. And we also have partnership working. So this encompasses a lot of things really, but this is us working with Sussex Partnership Foundation Trust to deliver services. It's us working with other organisations in the city, other statutory services, our commissioners, the council and the NHS, but also us as UOK and the lead provider facilitating partnership working within the partnership. So we have quarterly partnership meetings, we have lots of events, and we come together on common themes and topics. So yeah, that's us facilitating that and all coming together. So most of you on the call will hopefully have heard of the neighbourhood mental health teams. So these will be all over Sussex, but we're just going to focus on the Brighton and Hove. So this is a bit of a diagram about what they're going to look like. So Southdown is our lead provider. So we have 3 services within the core team. So that's Screen and Intervene, which is social prescribing and physical health checks. We have mental health support coordinators that sit in primary care networks. And we also have individual placement support, our employment support service. So they'll sit in the core team, and then all of the other UOK Brighton and Hove services will sit in aligned services. And yeah, we're looking forward to seeing how we can all connect in and how the mental health teams will work in practice. And we're also working closely with the integrated community teams, I should say. So this is our partnership. Lots of beautiful, colourful logos, as you can see. It was really, really hard to fit all of these on the slide. But our new partners are Sussex Interpreting Service, Bridging Change, Impact Initiatives, Dadler Soul, Amaze, St Luke's Advice Service, the Carers Centre, and SEDS Connective. And I think, yeah, all of those are approved partners already. So yeah, it's great to have some new partners in the partnership who are delivering different types of support for different people in our communities and all coming together. So I'll just talk a bit about Quell. So Quell is our digital mental health support platform. And you can access the platform anonymously 24/7 every single day of the year. So you could even have it even access it after your Christmas dinner if you so wished. So on Quell, there's some self-help resources, there's community support and practitioner intervention. And under self-help resources, there's a lot of different tools you can use. So you can do some goal setting, and you can monitor those personal goals over a set period of time, just to see how far you've come. There's also a journal which you can identify and track your mood triggers and track your mood, which is great. And under the community support, there's collections of a lot of different resources. So these are in the forms of videos, podcasts, articles, activities. As we know, not everyone sort of consumes content or learns in the same way. So this is a really good variety of different formats that people can engage with. There's also discussion boards. This is peer-to-peer support forums, which is a really great way to create those peer connections. I actually heard a story about a mother who was having an issue with her baby and reached out, and there was another mother who's going through exactly the same thing, and they actually bonded and ended up, creating a really good peer relationship. So it's really good for that. There's also magazines and podcasts with 70% user-generated content. So this is articles people have written on some topics that are affecting them, maybe stories of success and stories of recovery that are really, really important to share. And then practitioner interventions, there's a live chat with access to qualified practitioners, or you can drop in through pre-arranged online chat. And then there's a messaging service. So this is available so you can message them at any time, but they'll get back to you within 24 to 48 hours. So this is just where Quell can add value. So it's immediate support for people while they wait for specialist services, including talking therapies. It's also helpful for those that don't meet thresholds or criteria for other services, as we know that can sometimes be a barrier for our clients and patients. And out-of-hours support with practitioners online until 10 p.m. each night. So if people are working or they have other commitments during the day, they can speak to practitioners up to 10 p.m. It's also aftercare once discharged from other services. So a few of our partners have said, after our 6 sessions ended, I then gave them a leaflet to Quell, and now they're using Quell, which is fantastic. And it's an alternative to traditional community services. And support for those who wish to remain anonymous. So as we know, stigma is still a barrier for people, and it's also something that people perhaps don't want to try out straight away. So this is a space to try it out before choosing face-to-face therapies. And again, it goes back to our big mission of early intervention and prevention. So this is our Staying Well service. It's not actually funded through UOK, but it's a Southdown service. And I just think it's really, really important to mention, especially to professionals who could be sending clients and patients there. So Staying Well is a walk-in service for people experiencing a self-defined mental health crisis. And it's a place to get support and help without needing to make an appointment. It's in a safe, supportive and therapeutic environment. This picture here is our wellbeing hub at Preston Park. It's delivered from there. It's open 7 days a week, 365 days a year. And I really do like to think of it as sort of a next step of an A&E, but for mental health. And like a crisis cafe setup. So it's a fantastic service, and please do signpost people there. And the opening hours are down here. So it's open weekdays 5 to 10:30 and weekends 3 to 10:30. So now just UOK Central Access Point. So this is managed by our partners Together Co, who are a local loneliness and social health charity. So there is a phone number that you can call. This on the next slide. There's also an email address that you can email, and you can either ask for a call back or you can just chat over email. And you can also arrange a call back on our website. This is actually our preferred method for professionals getting in touch with you, okay? Just so that we have all the information straight up for when our central access point coordinators call you back. And there's also a box that you check on the website, on the web form, just to say that you are a professional. Or you can just visit our website for more information. So this also acts as a central access point. There is a wealth of information on there. There's lots of resources. There's access to Quell, there's directory, and there's actually a new men's mental health directory as well, which is on there, which is great. And yeah, there's all of those news articles and events to keep up to date with everything to do with UOK. So please do get in touch if someone you know or a client or patient needs support. I do always put please get in touch if you need support, because none of us are immune to struggling with our mental health. So please do reach out if you need to. This is our phone number. All calls are free. Lines are open Monday to Friday, 9 to 5, excluding bank holidays. Or you can visit our website, as I say, or you can email referrals@uok.org.uk. Thank you very much, everyone. I think that's enough of me talking. Over to you if you have any questions. And if you scan this QR code, that will get you to our website. Or you can just type it into your web browser. But thanks, everyone. Patricia, I think you have your hand up.
I just wondered, can you hear me okay?
I can, yes.
Yeah, I just wondered if there's any sort of, I don't know, horrible word, exclusion criteria, for people, say, for example, if someone's feeling quite suicidal or struggling in a more serious, in that sort of end of spectrum of mental health, in terms of accessing, say, the chat room or are there sort of, because of course it can be quite distressing if people are, if I was sort of saying to some of my people that I work with, in ATS, who sort of struggle with those sorts of thoughts. I didn't know if that would be a issue.
Is that for Quell, sorry, or for our central access point?
Yeah.
For
Yes.
Quell. So they do have triggers, so they can pick people if people are sounding like they might be suicidal or like they're really struggling quite severely. They can then pick them up and they refer on to local services. So yeah, Quell have a sort of a list of people they need to contact, or the Sussex Mental Health line. I know that they've also signposted people to Staying Well as well, but they wouldn't perhaps support people, in a crisis situation. They would refer or signpost on to other services.
But would they pick that up from the chat room? Would that be picked up? Is that monitored? I suppose that's what I'm asking.
It is, yeah.
Okay.
Everything's monitored. Yeah. So the peer-to-peer chat forums are all monitored, and the chat with the practitioners is obviously monitored by them, so that they can escalate anything if they need to.
Brilliant. Thank you.
I can see someone else has the hand up, but I can't see your name. Someone Brown, I think. Amy
It's
Brown.
Amy Brown.
Sorry.
Hi.
Just hovered.
So similar question, but I work in a specialist service, so I work in the eating disorder service. I'm just thinking about this idea about whilst waiting for specialist treatment, if we have a very long waiting list, unfortunately, and with varying physical risk as well as sort of psychological risk. How would that work in terms of, would there be any sort of thinking that we need to be done in terms of patients under our service to get involved with either Quell or even the central access point whilst they're waiting for treatment with us?
That'd be absolutely fine. Yeah, they can.
Great.
We can definitely refer on to Quell, and yeah, they can sort of have that support while they're waiting for services. And there's absolutely no exclusion criteria, so it's just for anyone 18 plus living in Brighton and Hove or East Sussex can access Quell.
What a brilliant resource. Thank you so much.
It's okay. Does anyone else have any questions? Or do feel free to put them in the chat if you wouldn't like to put your mic off. Lovely. If there's no more questions, I will leave you all to have a lovely day. And we will send around the slides afterwards, and there's a recording as well. So if there's anyone in your team that hasn't seen it, or if there's anyone you'd like to forward it on to, please do that. And there's also another live session next week on the, I want to say the 27th. No, it's on the 28th, sorry. So this time, no, sorry, it's on the 29th, next Wednesday. And there's also another public session tomorrow. So please do share those with your teams as well.
There's a question